Question 1. The evaluation methodology shows a proposed implementation of a new predictive analytics model designed to identify patients at high risk for hospital readmission. Which of the following risk assessment approaches best aligns with the principles of responsible health analytics and regulatory compliance? Option A. Prioritize the speed of model deployment to achieve immediate cost savings, assuming that any potential biases or privacy concerns will be addressed in future iterations. Option B. Focus solely on the technical accuracy and predictive power of the model, with minimal consideration for the ethical implications of its application or the potential for data breaches. Option C. Implement the model using existing data infrastructure without a specific review of data security protocols, as the organization already has general data protection policies in place. Option D. Conduct a comprehensive risk assessment that includes identifying potential sources of bias in the training data, evaluating the model's fairness across different demographic groups, and establishing clear protocols for data anonymization and secure storage. The correct answer is D. Conduct a comprehensive risk assessment that includes identifying potential sources of bias in the training data, evaluating the model's fairness across different demographic groups, and establishing clear protocols for data anonymization and secure storage. Explanation. The evaluation methodology shows a critical juncture in the application of health analytics within a healthcare organization. The challenge lies in balancing the immense potential of data-driven insights for improving patient care and operational efficiency against the inherent risks associated with data privacy, security, and potential biases within analytical models. Professionals must navigate a complex landscape of regulatory compliance, ethical considerations, and the practicalities of implementing and interpreting analytical outputs. This scenario demands careful judgment to ensure that the pursuit of business intelligence does not compromise patient trust or violate established legal frameworks. The correct approach emphasizes a proactive and comprehensive risk assessment integrated into the entire life cycle of health analytics initiatives. This aligns with best professional practices by prioritizing patient data protection and regulatory adherence. Specifically, it involves identifying potential threats to data confidentiality, integrity, and availability, as well as assessing the risk of biased or discriminatory outcomes from analytical models. This approach ensures that mitigation strategies are developed and implemented before significant harm can occur, thereby upholding ethical obligations and regulatory requirements such as those pertaining to patient privacy and data security. An incorrect approach that overlooks the potential for algorithmic bias in predictive models fails to acknowledge the ethical imperative to ensure equitable healthcare outcomes. This can lead to the perpetuation or exacerbation of existing health disparities, a significant ethical failure. Another incorrect approach that focuses solely on the technical implementation of analytics without considering the broader implications for patient consent and data governance overlooks critical regulatory requirements. This can result in breaches of patient privacy and a loss of trust, violating principles of informed consent and data stewardship. A third incorrect approach that prioritizes rapid deployment of analytical tools over thorough validation and testing risks, generating inaccurate insights, leading to suboptimal clinical decisions and potential patient harm, which is both an ethical and professional failing. Professionals should employ a decision-making framework that begins with a clear understanding of the regulatory landscape governing health data. This involves identifying all applicable laws and guidelines related to data privacy, security, and the ethical use of health information. Subsequently, a thorough risk assessment should be conducted for any proposed health analytics project, considering potential technical vulnerabilities, data quality issues, and the risk of biased outputs. This assessment should inform the development of robust data governance policies and security protocols. Finally, continuous monitoring and evaluation of analytical models and their impact are essential to ensure ongoing compliance, ethical integrity, and the achievement of desired outcomes without unintended negative consequences. Question 2. Compliance review shows that a healthcare organization's data stewardship team is responsible for managing access to patient data for various purposes, including clinical care, operational reporting, and research initiatives. The team is currently debating the best method for facilitating research requests for patient data, considering the need to protect patient privacy while enabling valuable insights. Which of the following approaches best aligns with the regulatory framework for healthcare data governance and stewardship in the United States, ensuring both data utility and patient privacy? Option A. Establish a clear data governance policy that outlines the process for research data requests, including requirements for data de-identification or anonymization, data use agreements, and an approval process involving a designated privacy officer and research ethics board. Option B. Prohibit all access to patient data for research purposes to eliminate any potential risk of privacy breaches. Option C. Grant broad, unrestricted access to raw patient data for all researchers who submit a request, assuming that researchers will handle the data responsibly. Option D. Allow individual data stewards to make ad hoc decisions on data access for research based on their personal judgment, without a formal policy or oversight. The correct answer is A. Establish a clear data governance policy that outlines the process for research data requests, including requirements for data de-identification or anonymization, data use agreements, and an approval process involving a designated privacy officer and research ethics board. Explanation. This scenario presents a common challenge in healthcare data governance, balancing the need for data accessibility for research and operational improvement with the stringent requirements for patient privacy and data security. The professional challenge lies in interpreting and applying the specific regulatory framework of the Associate Professional in Healthcare Information and Management Systems, APHIMS, jurisdiction, which is assumed to be governed by U.S. federal regulations like HIPAA, to a practical data stewardship situation. Careful judgment is required to ensure that all data handling practices align with legal mandates and ethical obligations. The correct approach represents best professional practice because it prioritizes a systematic, documented, and compliant process for data access and use. This involves establishing clear data governance policies, defining roles and responsibilities for data stewards, implementing robust de-identification or anonymization techniques where appropriate, and ensuring that all data access is authorized and audited. This aligns with the core principles of HIPAA, which mandates safeguards for protected health information, FI, and outlines requirements for data use agreements and patient consent. By adhering to these established protocols, the organization upholds its legal and ethical duty to protect patient privacy while enabling valuable data utilization. An incorrect approach that involves granting broad, unrestricted access to raw patient data for research purposes fails to adequately protect PHI. This directly violates HIPAA privacy rule, which sets strict limits on the use and disclosure of PHI. Such an approach would expose the organization to significant legal penalties, reputational damage, and erosion of patient trust. Another incorrect approach, which involves completely prohibiting any data access for research due to fear of noncompliance, represents an overzealous interpretation of privacy regulations. While privacy is paramount, HIPAA also recognizes the importance of data for research and public health. This approach stifles innovation and the potential for improving healthcare outcomes, failing to strike the necessary balance between privacy and utility. It demonstrates a lack of understanding of the permissible uses of de-identified data or data used under specific research protocols. A third incorrect approach, which relies solely on individual data steward discretion without established policies or oversight, is inherently risky. This can lead to inconsistent application of rules, potential for bias, and an increased likelihood of unintentional breaches. It bypasses the systematic controls necessary for effective data governance and compliance, leaving the organization vulnerable. The professional reasoning process for similar situations should involve a thorough understanding of the applicable regulatory framework, e.g., HIPAA in the U.S. context. This includes identifying the specific types of data involved, the intended purpose of data access, and the necessary safeguards. Professionals should consult existing data governance policies, engage with legal and compliance departments, and implement a risk-based approach to data access requests. Documenting all decisions, approvals, and data handling procedures is crucial for demonstrating compliance and accountability. Question 3. Risk assessment procedures indicate a potential unauthorized access to a patient database containing protected health information, FI, due to a suspected phishing attack on an employee's workstation. The incident response team has been activated. What is the most appropriate immediate course of action to manage this potential breach? Option A. Immediately shut down all network access for all employees to prevent further spread, and then begin an investigation into the phishing attack. Option B. Inform the affected employee that their workstation is suspected of being compromised and instruct them to refrain from using any company systems until further notice. Option C. Isolate the affected workstation from the network, preserve its state for forensic analysis, and initiate the organization's documented incident response plan, which includes assessing the scope of the breach and notifying relevant parties as per regulatory requirements. Option D. Proceed with restoring the patient database from the most recent backup without conducting a thorough forensic investigation to ensure data integrity. The correct answer is C. Isolate the affected workstation from the network, preserve its state for forensic analysis, and initiate the organization's documented incident response plan, which includes assessing the scope of the breach and notifying relevant parties as per regulatory requirements. Explanation: scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for critical patient care with the long-term imperative of protecting sensitive health information. The healthcare organization is facing a potential data breach, which carries significant legal, financial, and reputational risks. The urgency of the situation, coupled with the potential for widespread impact, necessitates a swift yet compliant response. The professional must navigate the complexities of incident response protocols while adhering strictly to the specified regulatory framework for the APHIMS exam. Correct approach analysis. The correct approach involves a systematic and documented incident response process that prioritizes containment, investigation, and notification in accordance with the relevant regulatory framework. This includes immediate steps to limit the scope of the breach, thorough forensic analysis to understand the root cause and extent of the compromise, and timely notification to affected individuals and regulatory bodies as mandated. This approach ensures accountability, minimizes further harm, and demonstrates a commitment to patient privacy and data security, aligning with the core principles of healthcare information management and the specific requirements of the APHIMS jurisdiction. Incorrect approaches analysis. One incorrect approach involves immediately shutting down all affected systems without proper investigation. This could disrupt critical patient care, potentially leading to adverse health outcomes, and may also hinder the forensic investigation by destroying crucial evidence. It fails to follow a structured incident response plan and could be seen as a failure to mitigate harm effectively. Another incorrect approach is to delay notification to affected individuals and regulatory bodies until a complete and perfect solution is found. This delay can violate mandatory breach notification timelines stipulated by regulations, leading to penalties and loss of trust. It also deprives individuals of the opportunity to take protective measures. A third incorrect approach is to downplay the severity of the incident and only conduct a superficial review. This demonstrates a lack of due diligence and a failure to adequately assess the risks to patient privacy. It neglects the organization's responsibility to protect protected health information, FI, and could result in significant legal repercussions and reputational damage. Professional reasoning. Professionals should employ a structured incident response framework. This typically involves preparation, having a plan in place, identification, detecting the incident, containment, limiting the damage, eradication, removing the cause, recovery, restoring systems, and lessons learned, improving future responses. When faced with a potential breach, the immediate steps should focus on containment and assessment, followed by a thorough investigation. Communication and notification should be initiated as soon as the scope and impact are understood, adhering to all regulatory timelines. This methodical approach ensures that patient care is considered, data is protected, and legal obligations are met. Question 4. Risk assessment procedures indicate that a new electronic health record, AIR, system is scheduled for deployment in 3 months. The implementation team is under pressure to expedite the go-live date to coincide with a new billing cycle, potentially shortening the planned security testing and user training phases. Which of the following approaches best balances the need for timely system adoption with the imperative to protect patient data and ensure regulatory compliance? Option A. Proceed with the expedited go-live, focusing initial user training on basic system navigation and deferring comprehensive security and privacy training until after the system is fully operational. Option B. Implement the EHR system with minimal security configurations to ensure rapid deployment, with plans to address security vulnerabilities and conduct user training in subsequent post-implementation phases. Option C. Delay the go-live date to allow for the full completion of all planned security testing, risk mitigation strategies, and comprehensive user training on security protocols and privacy policies before patient data is migrated. Option D. Prioritize the migration of patient data and system functionality for the billing cycle, implementing basic access controls and planning to conduct a full security audit and user training after the initial operational period. The correct answer is A. Proceed with the expedited go-live, focusing initial user training on basic system navigation and deferring comprehensive security and privacy training until after the system is fully operational. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for patient care with the long-term security and integrity of electronic health records, (EHR). The rapid deployment of a new EHR system, while beneficial for efficiency, introduces inherent risks related to data breaches, unauthorized access, and system vulnerabilities. The pressure to go live quickly can lead to shortcuts in critical security and privacy protocols, which are paramount in healthcare information management. Careful judgment is required to ensure that the system is not only functional, but also compliant with all applicable regulations and ethical standards. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a comprehensive and phased implementation that includes robust security controls and user training before full patient data migration and system go live. This aligns with the principles of data privacy and security mandated by healthcare regulations, which require proactive measures to protect protected health information. 5. Specifically, it demonstrates adherence to the security rule of HIPAA, Health Insurance Portability and Accountability Act, which mandates risk analysis, implementation of security measures, and ongoing monitoring. Training users on privacy and security protocols is crucial for preventing human error, a common vector for breaches. Incorrect approaches analysis. One incorrect approach fails by prioritizing speed over security, leading to a premature go-live without adequate risk mitigation. This directly violates the security rule of HIPAA, which requires a thorough risk assessment and the implementation of appropriate safeguards. It also exposes the organization to significant legal and financial penalties for potential data breaches and compromises patient trust. Another incorrect approach is to defer comprehensive security training until after the system is operational. This is a critical failure because user error is a significant threat to EHR security. Without proper training on access controls, data handling, and recognizing phishing attempts, staff are more likely to inadvertently compromise patient data, leading to regulatory violations and reputational damage. A third incorrect approach, focusing solely on technical security measures without addressing user access and data governance, is also flawed. While firewalls and encryption are important, they are insufficient on their own. Inadequate access controls can lead to unauthorized access to patient records, even if the system itself is technically secure. This contravenes the principle of least privilege and the HIPAA requirement for access controls to ensure that only authorized individuals can access PHI. Professional reasoning. Professionals should adopt a phased approach to EHR implementation, beginning with thorough risk assessments, followed by the implementation of technical and administrative safeguards, comprehensive user training, and finally, a controlled go-live with ongoing monitoring and auditing. This systematic process ensures that patient data is protected throughout the system lifecycle and that the organization remains compliant with all relevant regulations. Decision-making should always be guided by the principles of patient privacy, data security, and regulatory compliance, even under pressure for rapid deployment. Question 5. Stakeholder feedback indicates a consistent pattern of incomplete and ambiguous clinical documentation within several key service lines, potentially impacting care coordination and quality reporting. As a healthcare information management professional, what is the most appropriate initial approach to address this issue? Option A. Conduct a comprehensive risk assessment to identify root causes, potential impacts on patient care and operations, and develop targeted mitigation strategies before proposing solutions. Option B. Develop and deploy new, more prescriptive documentation templates across all affected service lines without prior pilot testing or extensive clinician input. Option C. Immediately implement a mandatory retraining program for all clinicians in the affected service lines, focusing on documentation standards and consequences of noncompliance. Option D. Initiate a disciplinary review process for clinicians identified as having the most frequent documentation deficiencies, with a focus on immediate corrective action. The correct answer is A. Conduct a comprehensive risk assessment to identify root causes, potential impacts on patient care and operations, and develop targeted mitigation strategies before proposing solutions. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for accurate clinical documentation with the potential for unintended consequences on physician workflow and patient care. A risk assessment approach is crucial to identify, analyze, and mitigate potential negative impacts before implementing changes. Careful judgment is needed to ensure that improvements in documentation do not compromise the quality or efficiency of care delivery. The correct approach represents best professional practice because it systematically evaluates the potential risks and benefits associated with proposed changes to clinical documentation. This aligns with the principles of responsible information management and patient safety, which are paramount in healthcare. By conducting a thorough risk assessment, healthcare organizations can proactively address concerns, develop mitigation strategies, and ensure that any improvements are implemented in a way that supports, rather than hinders, clinical operations and regulatory compliance. This proactive stance minimizes disruption and maximizes the likelihood of achieving desired outcomes. An incorrect approach that focuses solely on punitive measures for documentation errors fails to acknowledge the systemic factors that contribute to documentation issues. This can lead to physician burnout, decreased morale, and a superficial improvement in documentation that does not address underlying problems. Ethically, it can be seen as a failure to support clinicians and a lack of understanding of the complexities of clinical practice. From a regulatory perspective, while accuracy is required, a punitive approach without supportive measures may not fully meet the spirit of regulations that aim for improved patient care through accurate information. Another incorrect approach that prioritizes rapid implementation of new documentation templates without adequate testing or stakeholder input risks introducing new errors or inefficiencies. This can lead to frustration among clinicians, increased time spent on documentation, and potentially compromised patient safety if critical information is obscured or lost. This approach demonstrates a lack of due diligence and a disregard for the practical implications of system changes on the front lines of patient care, potentially violating ethical obligations to provide a functional and supportive work environment. A third incorrect approach that involves bypassing established change management protocols to quickly address perceived documentation gaps can lead to fragmented and inconsistent documentation practices. This can create significant challenges for data analysis, quality reporting, and continuity of care. It also undermines the integrity of the information systems and can lead to non-compliance with data governance policies and potentially regulatory requirements for standardized and accurate record-keeping. A professional decision-making process for similar situations should involve a structured risk assessment framework. This includes identifying all relevant stakeholders, understanding their perspectives and concerns, and collaboratively defining the scope of the problem. The next step is to identify potential risks and benefits associated with various solutions, evaluating their likelihood and impact. Mitigation strategies should then be developed for identified risks. Finally, a phased implementation plan with ongoing monitoring and evaluation is essential to ensure that the chosen solution effectively addresses the problem without creating new ones. This iterative process ensures that decisions are data-driven, ethically sound, and aligned with organizational goals and regulatory mandates. Question 6. The audit findings indicate potential vulnerabilities in the security protocols of the organization's telehealth platform, raising concerns about the confidentiality and integrity of patient health information transmitted remotely. What is the most appropriate immediate course of action? Option A. Rely solely on the telehealth vendors' assurances that their platform meets all regulatory security standards. Option B. Initiate a comprehensive risk assessment of the telehealth system and implement enhanced security measures to address identified vulnerabilities. Option C. Immediately suspend all telehealth services until a complete overhaul of the system can be completed. Option D. Dismiss the findings as minor technical issues, assuming the vendor's standard security features are sufficient. Correct answer is B. Initiate a comprehensive risk assessment of the telehealth system and implement enhanced security measures to address identified vulnerabilities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the benefits of expanded telehealth services with the critical need for patient privacy and data security, particularly concerning sensitive health information transmitted remotely. The audit findings highlight a potential gap in compliance, necessitating a decision that upholds regulatory standards while enabling continued service delivery. The core challenge lies in ensuring that the chosen solution is not only technically feasible, but also legally sound and ethically responsible within the specified regulatory framework. Correct approach analysis. The correct approach is to immediately initiate a comprehensive risk assessment and implement enhanced security protocols. This aligns directly with the principles of data protection and patient privacy mandated by healthcare regulations. A risk assessment systematically identifies vulnerabilities in the telehealth system, allowing for targeted mitigation strategies. Implementing enhanced security protocols, such as robust encryption, secure authentication methods, and regular security audits, directly addresses these identified risks. This proactive and systematic approach ensures that patient data remains confidential and protected, thereby complying with regulatory requirements and maintaining patient trust. This is best professional practice as it prioritizes patient safety and regulatory adherence. Incorrect approaches analysis. One incorrect approach is to dismiss the audit findings as minor technical glitches without further investigation. This fails to acknowledge the potential for significant data breaches and regulatory noncompliance. Such an approach ignores the proactive duty to protect patient information and could lead to severe penalties, reputational damage, and loss of patient confidence. It represents a failure to adhere to the principle of due diligence in data security. Another incorrect approach is to immediately halt all telehealth services without a thorough assessment. While caution is important, an outright suspension without understanding the scope and nature of the identified issues is an overreaction. It disrupts patient care and access to services, which can have negative health outcomes. This approach fails to apply a reasoned decision-making process that balances risk mitigation with service continuity. A third incorrect approach is to rely solely on vendor assurances without independent verification. While vendors provide security solutions, healthcare organizations have a direct regulatory responsibility for the protection of patient data. Blindly trusting vendor claims without conducting internal assessments or verifying their security practices can lead to overlooked vulnerabilities and non-compliance. This demonstrates a failure to exercise independent professional judgment and due diligence. Professional reasoning. Professionals should employ a structured decision-making framework when faced with audit findings related to telehealth systems. This framework involves 1. Understanding the specific regulatory requirements applicable to telehealth and data security within the defined jurisdiction. 2. Thoroughly investigating the audit findings to determine the nature and severity of any identified risks. 3. Conducting a comprehensive risk assessment to evaluate potential impacts on patient privacy and data integrity. 4. Developing and implementing appropriate mitigation strategies, prioritizing those that offer the strongest protection and regulatory compliance. 5. Documenting all actions taken and decisions made. 6. Regularly reviewing and updating security measures to adapt to evolving threats and regulatory changes. This systematic approach ensures that decisions are evidence-based, compliant, and ethically sound, prioritizing patient well-being and organizational integrity. Question 7. Strategic planning requires a comprehensive understanding of how healthcare information systems, HIS, contribute to organizational goals. Considering the diverse perspectives of key stakeholders, which approach best defines the importance of HIS for strategic planning within a healthcare organization. Option A. Defining the importance of HIS by their function in providing robust data for financial reporting and billing, ensuring the organization's fiscal health. Option B. Defining the importance of HIS by their role in adopting the most advanced technological innovations to maintain a competitive edge in the healthcare market. Option C. Defining the importance of HIS by their capacity to enhance clinical decision-making, improve patient safety through data accuracy and accessibility, and support population health management initiatives. Option D. Defining the importance of his by their ability to streamline administrative processes and reduce operational costs, thereby freeing up resources for direct patient care. The correct answer is D. Defining the importance of his by their ability to streamline administrative processes and reduce operational costs, thereby freeing up resources for direct patient care. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of different healthcare stakeholders with the long-term strategic vision for healthcare information systems. The importance of his lies in their ability to improve patient care, enhance operational efficiency, and support research and public health initiatives. A failure to adequately consider the diverse perspectives of stakeholders during strategic planning can lead to his implementations that are not adopted, do not meet critical needs, or even create new inefficiencies and risks. Careful judgment is required to synthesize these varied viewpoints into a cohesive and actionable strategy. The correct approach represents best professional practice because it prioritizes a comprehensive understanding of stakeholder needs and the strategic value of his. By engaging all key groups, including clinicians, administrators, IT professionals, and even patients, the organization ensures that his strategy aligns with operational realities, clinical workflows, and overarching organizational goals. This inclusive approach fosters buy-in, facilitates effective implementation, and maximizes the return on investment in his. Furthermore, adhering to the principles of healthcare information management, as guided by relevant professional bodies and regulatory frameworks, e.g., HIPAA in the U.S., if applicable to the APHIMS jurisdiction, ensures that his strategy supports data integrity, security, privacy, and interoperability, all critical for patient safety and regulatory compliance. An incorrect approach that focuses solely on cost reduction without considering functional requirements or clinical impact is professionally unacceptable. This failure stems from a misunderstanding of the true value of his, which extends beyond mere financial savings to encompass improved patient outcomes and operational effectiveness. Such an approach risks implementing systems that are inadequate, leading to workarounds, decreased clinician satisfaction, and potentially compromise patient care, which could have regulatory implications if patient safety is affected. Another incorrect approach that prioritizes the latest technological trends without assessing their alignment with organizational needs and existing infrastructure is also professionally unsound. This can lead to significant financial waste, implementation challenges, and systems that are difficult to integrate or maintain. Ethically, it fails to be a responsible steward of organizational resources and may not deliver the promised benefits to patient care or operational efficiency. Finally, an approach that solely relies on the IT department's technical expertise without broader stakeholder input neglects the critical user perspective. While IT expertise is vital for technical feasibility, his are tools for healthcare professionals and administrators. Ignoring their input can result in systems that are not user-friendly, do not support essential workflows, and ultimately fail to achieve their intended purpose, potentially leading to data errors or inefficiencies that could have regulatory consequences. The professional decision-making process for similar situations should involve a structured stakeholder analysis, a clear definition of his goals aligned with organizational strategy, a thorough assessment of current and future needs, and a robust evaluation of potential his solutions based on functionality, usability, security, interoperability, and return on investment. This process should be iterative and involve continuous communication and feedback from all relevant parties. Question 8. Operational review demonstrates that a healthcare organization is planning to implement fast healthcare interoperability resources, APHIMS, to improve data exchange with external partners. The organization must select the most appropriate strategy for this implementation, considering regulatory compliance and patient privacy. Which of the following strategies best aligns with professional best practices for APHIMS implementation in a regulated healthcare environment? Option A. Develop a phased APHIMS implementation plan, starting with less sensitive data elements and progressively incorporating more complex and sensitive information, accompanied by comprehensive risk assessments and robust security controls at each stage. Option B. Prioritize the technical development of APHIMS APIs without establishing clear organizational policies for data access, usage, and auditing, assuming that technical controls will inherently manage privacy. Option C. Postpone the APHIMS implementation until all potential security vulnerabilities are identified and completely mitigated, even if this significantly delays interoperability benefits. Option D. Implement APHIMS interfaces for all patient data immediately, relying on existing network security to protect data during transit and at rest. The correct answer is D. Implement APHIMS interfaces for all patient data immediately, relying on existing network security to protect data during transit and at rest. Explanation: this scenario presents a common implementation challenge in healthcare IT, ensuring data security and patient privacy while enabling interoperability through APHIMS. The professional challenge lies in balancing the benefits of data sharing for improved patient care and operational efficiency against the inherent risks of exposing sensitive health information. Careful judgment is required to select an implementation strategy that adheres to regulatory mandates and ethical obligations. The correct approach represents best professional practice because it prioritizes a phased, risk-based implementation of APHIMS, starting with less sensitive data and progressively incorporating more complex, sensitive information. This aligns with the principles of data minimization and the need for robust security controls before full data exchange. Specifically, it acknowledges the need for comprehensive risk assessments and the implementation of appropriate technical and administrative safeguards as mandated by relevant healthcare privacy regulations. This methodical approach ensures that patient privacy is protected at every stage of the APHIMS implementation, fostering trust and compliance. An incorrect approach that involves immediately exposing all patient data through APHIMS without adequate security measures or phased rollout is professionally unacceptable. This would constitute a direct violation of patient privacy regulations, potentially leading to significant data breaches, reputational damage, and severe legal penalties. It demonstrates a failure to conduct thorough risk assessments and implement necessary controls, thereby disregarding the ethical obligation to protect sensitive health information. Another incorrect approach that focuses solely on technical APHIMS implementation without considering the organizational policies, training, and governance structures necessary for secure data handling is also professionally flawed. While technical interoperability is crucial, it is insufficient without the supporting framework to manage data access, usage, and security. This oversight can lead to unauthorized access or misuse of patient data, even if the APHIMS interfaces themselves are technically sound. Finally, an approach that delays APHIMS implementation indefinitely due to perceived complexity or fear of noncompliance, without actively seeking solutions or engaging in a structured, compliant implementation process, is also professionally deficient. This inaction hinders the potential benefits of interoperability for patient care and operational efficiency, and fails to proactively address the evolving landscape of healthcare data exchange. Professionals should employ a decision-making framework that begins with a thorough understanding of the regulatory requirements and ethical considerations. This involves conducting comprehensive risk assessments, developing a phased implementation plan that prioritizes security and privacy, and ensuring adequate training and governance are in place. Continuous monitoring and adaptation to evolving threats and regulations are also critical components of responsible APHIMS implementation. Question 9. Assessment of a patient encounter where a physician performed debridement of a stage III pressure ulcer on the patient's sacrum and applied a specific advanced wound dressing. The physician's documentation states debrided sacral pressure ulcer, stage III, and applied X dressing. Which of the following represents the most accurate and compliant coding approach for this encounter, considering the need to capture the diagnosis, procedure, and supplies? Option A. Assign an ICD-10 code for the pressure ulcer, a CPT code for wound debridement, and a HCPCS level II code for the specific advanced wound dressing. Option B. Assign an ICD-10 code for the pressure ulcer and a CPT code for wound debridement, but do not assign a HCPCS level II code for the dressing as it is considered inclusive. Option C. Assign an ICD-10 code for the pressure ulcer and a CPT code for wound debridement, and use a generic HCPCS level II code for wound care supplies. Option D. Assign an ICD-10 code for the pressure ulcer and a CPT code for general wound care, omitting any code for the dressing. The correct answer is A. Assign an ICD-10 code for the pressure ulcer, a CPT code for wound debridement, and a HCPCS level Roman II code for the specific advanced wound dressing. Explanation: scenario analysis. This scenario is professionally challenging because it requires the HIM professional to navigate the complexities of multiple coding systems, IC 10cm, CPT, HCPCS level Roman II, and apply them accurately to a patient encounter. The ambiguity in the physician's documentation regarding the specific type of wound care and the associated supplies necessitates careful interpretation and adherence to coding guidelines. Misinterpretation can lead to inaccurate billing, potential compliance issues, and impact reimbursement. Correct approach analysis. The correct approach involves a systematic review of the physician's documentation, cross-referencing with official coding guidelines for ICD-10cm, CPT, and HCPCS level Roman II. This includes identifying the primary diagnosis using ICD-10cm, selecting the appropriate CPT code for the procedure performed, wound debridement, and then identifying the correct HCPCS level Roman II code for any supplies used that are separately billable. This approach ensures that all aspects of the patient encounter are coded accurately and compliantly, reflecting the services rendered and the supplies provided. Adherence to the official guidelines for coding and reporting and the National Correct Coding Initiative, NCCI, edits is paramount for accurate reimbursement and to avoid fraud and abuse allegations. Incorrect approaches analysis. One incorrect approach would be to assign a generic CPT code for wound care without specific documentation of the debridement performed. This fails to accurately represent the service provided and could lead to under- or over-reimbursement, violating principles of accurate billing, and potentially the False Claims Act if intentional. Another incorrect approach would be to assign an ICD-10cm code for a condition that is not clearly documented as the primary reason for the encounter or procedure. This misrepresents the patient's condition and the medical necessity for the services, leading to billing inaccuracies and potential compliance violations. A third incorrect approach would be to use a HCPCS level Roman II code for a supply that is considered inclusive in the CPT code for the procedure or is not a separately billable item according to payer policies. This constitutes improper billing and could be considered fraudulent. Professional reasoning. Professionals should approach such scenarios by first thoroughly reviewing all available documentation. They should then consult the relevant coding manuals and official guidelines, ICD-10cm official guidelines for coding and reporting, CPT Professional Edition, HCPCS level Roman II national codes, to identify the most specific and accurate codes. If documentation is ambiguous, the professional should query the physician for clarification, rather than making assumptions. This iterative process of documentation review, guideline application, and physician query ensures coding accuracy and compliance. Question 10. Comparative studies suggest that effective health data management hinges on a delicate balance between data utility and patient privacy. A researcher requests access to a dataset containing patient demographic information, diagnoses, and treatment outcomes for a study on a specific chronic disease. The researcher states the data is for de-identified analysis and will be used solely for academic publication. What is the most appropriate course of action for the healthcare information management professional to ensure regulatory compliance and ethical data handling? Option A. Conduct a thorough review of the data request against institutional policies and relevant regulations, verifying the de-identification process and the proposed data use to ensure it aligns with patient consent or permissible use clauses, and that secure data transfer protocols are in place. Option B. Deny the request outright, as any request for patient data for external research poses an unacceptable risk to patient privacy, regardless of stated intentions. Option C. Forward the request directly to the researcher's institution for them to manage the data access and de-identification process, as they are responsible for their research. Option D. Immediately grant the researcher access to the data, trusting their assertion that the data will be de-identified and used only for academic purposes, as this promotes research collaboration. The correct answer is A. Conduct a thorough review of the data request against institutional policies and relevant regulations, verifying the de-identification process and the proposed data use to ensure it aligns with patient consent or permissible use clauses, and that secure data transfer protocols are in place. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare information management, balancing the need for data accessibility for research and quality improvement with the stringent requirements for patient privacy and data security. The professional is tasked with facilitating data sharing while ensuring compliance with applicable regulations, which requires a nuanced understanding of data governance principles and legal mandates. The challenge lies in interpreting and applying these regulations to a specific, real-world data request, where misinterpretation can lead to significant legal, ethical, and reputational consequences. Correct approach analysis. The correct approach involves a thorough review of the data request against established institutional policies and relevant regulations. This includes verifying that the proposed data use aligns with the patient's consent, if applicable, or that appropriate de-identification or anonymization techniques have been employed to protect privacy. It also necessitates confirming that the data sharing mechanism itself adheres to security standards to prevent unauthorized access or breaches. This approach represents best professional practice because it prioritizes patient rights and regulatory compliance, ensuring that data is handled responsibly and ethically. It demonstrates a commitment to safeguarding protected health information. 5. As mandated by governing frameworks. Incorrect approaches analysis. One incorrect approach is to immediately grant access to the requested data without a formal review process. This fails to uphold the principle of least privilege and bypasses essential safeguards for patient privacy, potentially violating regulations that govern the use and disclosure of PHI. Another incorrect approach is to deny the request outright without exploring permissible uses or de-identification options. This can hinder valuable research and quality improvement initiatives that could benefit patient care and may not be compliant with regulations that permit data use under specific conditions. A third incorrect approach is to rely solely on the researcher's assertion of compliance without independent verification. This abdicates the professional's responsibility to ensure data security and privacy, leaving the organization vulnerable to regulatory penalties and breaches of trust. Professional reasoning. Professionals in healthcare information management should adopt a systematic decision-making process when faced with data access requests. This process should begin with understanding the nature of the request and the data involved. Next, it requires consulting relevant institutional policies and regulatory requirements. Professionals should then assess the request against these guidelines, considering factors such as consent, de-identification, security protocols, and the purpose of the data use. If the request meets all criteria, it can be approved. If not, the professional should explore alternative compliant methods for data access or provide clear reasons for denial based on regulatory or policy grounds. This structured approach ensures that decisions are informed, defensible, and aligned with professional ethics and legal obligations. Question 11. The risk matrix shows a high likelihood and high impact for a potential data breach if the legacy patient portal remains operational without immediate security patches. The IT department proposes a temporary workaround to restore full functionality within 24 hours, while the security team recommends a phased approach to patch and test the system over the next week, which would delay full functionality by 3 days. Which approach best aligns with the principles of responsible healthcare information system management and data protection? Option A. Deploy the temporary workaround proposed by the IT department to restore full functionality immediately. Option B. Implement the phased patching and testing approach recommended by the security team. Option C. Rely on the IT department's assurance that the temporary workaround is sufficiently secure. Option D. Deactivate the patient portal entirely until a permanent, fully tested solution is available. The correct answer is B. Implement the phased patching and testing approach recommended by the security team. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for system functionality with the long-term implications of security vulnerabilities. Healthcare information systems handle highly sensitive patient data, making any compromise a significant breach of trust and regulatory compliance. The pressure to restore services quickly can lead to shortcuts that introduce unacceptable risks. Careful judgment is required to ensure that risk mitigation strategies are effective and sustainable, not just temporary fixes. The correct approach represents best professional practice because it prioritizes a systematic and documented process for identifying, assessing, and mitigating risks before implementing a solution. This aligns with the principles of robust information security management, which are implicitly or explicitly mandated by healthcare regulations aimed at protecting patient privacy and data integrity. By involving relevant stakeholders and documenting the decision-making process, it ensures accountability and provides a clear audit trail, demonstrating due diligence in safeguarding protected health information. 5. This proactive and thorough approach minimizes the likelihood of future breaches and ensures compliance with the spirit and letter of healthcare data protection laws. An incorrect approach that focuses solely on speed without a proper risk assessment fails to uphold the fundamental duty to protect patient data. This oversight can lead to significant regulatory penalties, reputational damage, and erosion of patient trust. Specifically, bypassing a formal risk assessment violates the principles of data security and privacy mandated by healthcare regulations, which require organizations to implement appropriate administrative, physical, and technical safeguards. Another incorrect approach that relies on anecdotal evidence or the opinion of a single individual, rather than a structured assessment, is inherently unreliable and unprofessional. It lacks the objectivity and rigor necessary to make informed decisions about system security and patient data protection. This approach is ethically unsound, as it places the organization at undue risk. Professionals should employ a decision-making framework that begins with a clear understanding of the potential impact of a system failure on patient care and data security. This should be followed by a comprehensive risk assessment process that identifies threats, vulnerabilities, and potential impacts. Based on the assessment, appropriate mitigation strategies should be developed and prioritized, considering factors such as likelihood, impact, and cost-effectiveness. Implementation should be followed by ongoing monitoring and review to ensure the effectiveness of controls and adapt to evolving threats. Documentation at each stage is crucial for accountability and continuous improvement. Question 12. To address the challenge of selecting a new electronic health record system for a multi-specialty clinic, which approach best aligns with ensuring both operational efficiency and regulatory compliance under U.S. healthcare frameworks? Option A. Select the most cost-effective EHR solution available, focusing primarily on upfront purchase price and implementation fees. Option B. Conduct a thorough needs assessment involving clinical staff, IT, and administration to identify specific workflow requirements, data management needs, and security protocols. Then evaluate EHRs against these criteria, ensuring alignment with HIPAA regulations. Option C. Rely exclusively on the recommendations of the top 3 EHR vendors, choosing the one that offers the most comprehensive marketing package. Option D. Prioritize a system with advanced analytics and AI capabilities, assuming these features will automatically enhance patient care and data security. Correct answer is D. Prioritize a system with advanced analytics and AI capabilities, assuming these features will automatically enhance patient care and data security. Explanation. The scenario presents a common implementation challenge in healthcare information systems, selecting the most appropriate system to meet diverse organizational needs while adhering to regulatory mandates. The professional challenge lies in balancing the immediate operational requirements with long-term strategic goals and compliance obligations. Careful judgment is required to avoid costly errors, ensure patient safety, and maintain data integrity. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the organization's specific needs, workflows, and existing infrastructure. This methodical approach ensures that the chosen system will integrate effectively, support clinical decision-making, and meet regulatory requirements such as those mandated by HIPAA, Health Insurance Portability and Accountability Act, in the United States, which governs the privacy and security of protected health information. 5. A thorough needs assessment, involving key stakeholders, is crucial for selecting a system that enhances efficiency, improves patient care, and facilitates compliance with data security and privacy standards. An incorrect approach that focuses solely on cost reduction without a thorough needs assessment is professionally unacceptable. This failure to consider functional requirements and integration capabilities can lead to a system that is inefficient, difficult to use, and ultimately fails to meet the organization's objectives. From a regulatory perspective, such a system might not adequately support HIPAA security rule, potentially exposing PHI to unauthorized access or breaches, leading to significant fines and reputational damage. Another incorrect approach that prioritizes the latest technological features without evaluating their relevance to the organization's specific clinical and administrative processes is also professionally unsound. While innovation is important, adopting technology for its own sake can result in a system that is overly complex, difficult to implement, and does not align with user needs or existing workflows. This can hinder adoption, reduce productivity, and potentially compromise patient safety if the system does not accurately capture or present critical patient information. Ethically, this approach could be seen as a failure to act in the best interest of the organization and its patients by not selecting the most suitable and effective solution. A third incorrect approach that relies on vendor recommendations without independent validation is also problematic. While vendors have expertise, their primary goal is sales. Without independent verification of claims and a thorough understanding of the organization's unique environment, the organization risks selecting a system that is not a good fit. This can lead to implementation failures, unmet needs, and potential noncompliance with regulations, as the system may not adequately support required data management and security protocols. The professional decision-making process for similar situations should involve a structured approach. 1. Define clear organizational goals and objectives for the new system. 2. Conduct a comprehensive needs assessment involving all relevant departments and stakeholders. Research and evaluate potential systems based on functionality, interoperability, security features, vendor reputation, and total cost of ownership. 4. Prioritize systems that demonstrate strong compliance with relevant regulations, e.g. HIPAA. 5. Develop a robust implementation and training plan. 6. Conduct thorough testing and validation before full deployment. 7. Establish ongoing monitoring and evaluation processes. Question 13. Comparative studies suggest that optimizing clinical workflows can significantly enhance patient outcomes and operational efficiency. A healthcare organization is considering implementing a new electronic health record (EHR) module designed to streamline medication reconciliation. This module promises to reduce manual data entry and improve the accuracy of medication lists. However, the implementation team is eager to deploy it quickly to realize these benefits. What is the most appropriate approach to ensure this process improvement is both effective and compliant with healthcare information management regulations? Option A. Focus solely on the technical aspects of integrating the new EHR module, relying on the vendor's assurances of compliance, and delegate the responsibility for privacy and security oversight to individual end users. Option B. Prioritize rapid deployment of the new EHR module to achieve immediate efficiency gains, and address any potential data privacy or security concerns that arise after the system is live through ad hoc adjustments. Option C. Immediately integrate the new EHR module into the existing system, assuming that a modern EHR inherently meets all regulatory requirements for data privacy and security, and provide minimal on-the-job training to staff as they encounter issues. Option D. Conduct a thorough workflow analysis. Identify specific areas for improvement within the medication reconciliation process. Develop a detailed implementation plan that includes a comprehensive risk assessment for PHI, and ensure all staff receive adequate training on the new module and its privacy implications before full deployment. The correct answer is D. Conduct a thorough workflow analysis. Identify specific areas for improvement within the medication reconciliation process. Develop a detailed implementation plan that includes a comprehensive risk assessment for PHI, and ensure all staff receive adequate training on the new module and its privacy implications before full deployment. Explanation. This scenario is professionally challenging because it requires balancing the immediate need for improved patient care and operational efficiency with the stringent requirements of healthcare data privacy and security regulations. The introduction of new technology and workflow changes can inadvertently create vulnerabilities if not meticulously planned and implemented with compliance as a core consideration. Careful judgment is required to ensure that process improvements do not compromise patient confidentiality or data integrity, which are paramount under healthcare information management regulations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based methodology for clinical workflow and process improvement that is inherently compliant with healthcare information management regulations. This approach involves a thorough analysis of the current state, identification of specific pain points, and opportunities for improvement, and the development of solutions that integrate seamlessly with existing compliance systems and protocols. Crucially, it mandates a comprehensive risk assessment and the implementation of appropriate safeguards to protect protected health information, (PHI), throughout the entire lifecycle of the process change. This aligns with the core principles of data protection and patient privacy mandated by healthcare regulations, ensuring that any improvements do not lead to breaches or unauthorized access. An incorrect approach that focuses solely on technological implementation without considering the regulatory implications would fail to adequately address data privacy and security. This could lead to the inadvertent exposure of PHI, violating regulations that mandate strict controls over access, use, and disclosure of patient data. Another incorrect approach that bypasses formal change management and risk assessment processes, even with good intentions, risks introducing unforeseen vulnerabilities. This failure to follow established governance and compliance protocols is a direct contravention of regulatory requirements for managing changes within healthcare information systems. A third incorrect approach that prioritizes speed over thoroughness, neglecting to involve all relevant stakeholders, including compliance and legal teams, is also professionally unacceptable. This oversight can result in the implementation of solutions that, while seemingly efficient, are not legally sound or ethically defensible, potentially leading to significant regulatory penalties and reputational damage. Professional reasoning in such situations should follow a structured decision-making process. This involves 1. Clearly defining the problem and desired outcomes. 2. Conducting a comprehensive assessment of the current workflow, identifying inefficiencies and potential risks. 3. Researching and evaluating potential solutions, with a strong emphasis on their compliance with all applicable healthcare information management regulations. 4. Performing a thorough risk assessment for each proposed solution, identifying potential data privacy and security vulnerabilities, and developing mitigation strategies. 5. Engaging all relevant stakeholders, including IT, clinical staff, compliance officers, and legal counsel, in the evaluation and selection process. 6. Developing a detailed implementation plan that includes training, testing, and ongoing monitoring to ensure continued compliance and effectiveness. 7. Establishing clear metrics for success and a feedback loop for continuous improvement. Question 14. Cost-benefit analysis shows that implementing a comprehensive disaster recovery and business continuity plan with redundant systems and off-site data backups would significantly increase IT operational costs by 15% annually, while the probability of a catastrophic system failure requiring such measures is estimated at less than 5% over the next decade. The organization is facing pressure to reduce departmental budgets. As the associate professional in healthcare information and management systems, what is the most ethically and regulatorily sound course of action? Option A. Suggest outsourcing all IT operations to a third-party vendor that claims to have robust disaster recovery capabilities, without conducting a thorough due diligence on the vendor's specific plans and compliance with U.S. healthcare regulations. Option B. Advocate for the full implementation of the comprehensive disaster recovery and business continuity plan, emphasizing the potential catastrophic impact of a system failure on patient care, data integrity, and regulatory compliance, and propose phased implementation or alternative funding sources if immediate full funding is not feasible. Option C. Recommend deferring significant investments in disaster recovery and business continuity, focusing instead on immediate cost-saving measures, and plan to address DR/BC needs only if a specific threat emerges. Option D. Propose a minimal disaster recovery and business continuity plan that meets the absolute lowest regulatory threshold for data backup, without investing in redundant systems or off-site storage, to manage immediate budget constraints. Correct answer is B. Advocate for the full implementation of the comprehensive disaster recovery and business continuity plan, emphasizing the potential catastrophic impact of a system failure on patient care, data integrity, and regulatory compliance, and propose phased implementation or alternative funding sources if immediate full funding is not feasible. Explanation. This scenario presents a common ethical dilemma in healthcare IT management, balancing the imperative of patient data protection and service continuity with budgetary constraints. The challenge lies in the inherent tension between the ideal state of disaster recovery and business continuity, DR/BC preparedness, and the practical realities of resource allocation. A healthcare organization must ensure it can continue critical operations and protect sensitive patient information in the face of disruptive events, which is a fundamental requirement under U.S. healthcare regulations. The ethical obligation to safeguard patient data and ensure access to care is paramount. The correct approach prioritizes patient safety and regulatory compliance by advocating for the necessary investment in robust DR/BC measures, even if the initial cost-benefit analysis appears unfavorable in the short term. This aligns with the spirit and letter of regulations like HIPAA, which mandates safeguards to protect the confidentiality, integrity, and availability of electronic protected health information (EFI). Investing in comprehensive DR/BC plans is not merely an IT expense, but a critical component of patient care and risk management, ensuring that essential healthcare services can be maintained and patient data remains accessible and secure during emergencies. This proactive stance demonstrates a commitment to patient well-being and organizational resilience, which are core ethical responsibilities for healthcare information management professionals. An incorrect approach that solely focuses on the immediate cost savings without adequately addressing the potential impact of a disaster on patient care and data security would be professionally unacceptable. This would represent a failure to uphold the duty of care owed to patients and a disregard for regulatory mandates. For instance, deferring essential DR/BC upgrades to save money, despite a known risk, could lead to significant breaches of patient confidentiality, disruption of critical medical services, and substantial financial penalties and reputational damage if an incident occurs. Such a decision would likely violate HIPAA security rule, which requires covered entities to implement appropriate administrative, physical, and technical safeguards to protect the integrity and availability of EPHI. Furthermore, it would be an ethical lapse, prioritizing financial expediency over patient safety and data protection. Another incorrect approach might involve implementing a DR/BC plan that is technically compliant but lacks sufficient testing or fails to account for the human element of disaster response. While appearing to meet minimum requirements, such a plan would be inadequate in practice. The regulatory framework expects not just the existence of a plan, but its effectiveness, which is proven through regular testing and validation. A failure to adequately test the plan could lead to its failure during a real disaster, resulting in the same negative consequences as having no plan at all. This would also be a failure to meet the spirit of the regulations, which aim for actual resilience, not just theoretical preparedness. The professional decision-making process for such situations should involve a thorough risk assessment that quantifies not only the financial costs of DR/BC, but also the potential costs of inaction, including regulatory fines, legal liabilities, reputational damage, and most importantly, the impact on patient care and safety. This assessment should be presented to organizational leadership with clear recommendations that prioritize patient well-being and regulatory compliance. Engaging stakeholders from clinical, administrative, and IT departments is crucial to ensure the DR/BC plan is comprehensive and practical. The ultimate decision should be guided by a commitment to ethical principles and a deep understanding of the regulatory landscape, ensuring that the organization is prepared to meet its obligations to patients and regulatory bodies. Question 15. The control framework reveals that a healthcare organization is seeking to implement a new system for exchanging patient clinical summaries with external providers. The organization's primary objective is to ensure seamless interoperability while strictly adhering to all applicable federal regulations governing the privacy and security of protected health information. 5. Which of the following approaches best aligns with these objectives and regulatory mandates? Option A. Utilizing a custom-built data exchange mechanism that leverages existing internal infrastructure, focusing on ease of integration with current systems, without explicit validation against federal interoperability and security mandates. Option B. Adopting a proprietary data exchange solution that offers advanced features and a user-friendly interface, prioritizing rapid implementation and cost-effectiveness over strict adherence to all federal exchange standards. Option C. Employing a general-purpose file transfer protocol that allows for quick data sharing, assuming that data encryption will be handled at the application layer by individual providers. Option D. Implementing a protocol that is widely adopted within the healthcare industry and has demonstrated robust security features, ensuring it is certified under the relevant federal standards for health information exchange. The correct answer is D. Implementing a protocol that is widely adopted within the healthcare industry and has demonstrated robust security features, ensuring it is certified under the relevant federal standards for health information exchange. Explanation. This scenario presents a common challenge in healthcare IT, balancing the need for efficient data exchange with the imperative to protect patient privacy and comply with regulatory mandates. Professional challenge lies in selecting the most appropriate data exchange protocol that meets both functional and compliance requirements within the specified regulatory environment. Careful judgment is required to avoid compromising data integrity, security, or patient confidentiality. The correct approach represents best professional practice because it prioritizes adherence to the established regulatory framework governing healthcare data exchange. This framework, which dictates the standards and protocols permissible for sharing protected health information, FI, ensures that data is exchanged securely and in a manner that respects patient rights. By selecting a protocol that is explicitly recognized and supported by this framework, the organization demonstrates a commitment to compliance, patient safety, and data governance. This proactive stance minimizes the risk of breaches, penalties, and reputational damage. An incorrect approach that relies on a proprietary or non-standardized protocol fails to meet regulatory requirements. Such a protocol may not incorporate the necessary security safeguards, e.g., encryption, audit trails mandated by law, or it may not be interoperable with other systems in a compliant manner. This creates significant vulnerabilities for PHI, exposing it to unauthorized access or disclosure, which constitutes a direct violation of patient privacy laws and ethical obligations. Another incorrect approach that focuses solely on speed or ease of implementation without considering regulatory compliance is equally problematic. While efficiency is desirable, it cannot supersede legal and ethical responsibilities. Implementing a protocol that is not compliant, even if it is quick and easy, exposes the organization to severe legal repercussions, including fines and sanctions, and erodes patient trust. The professional decision-making process for similar situations should involve a thorough understanding of the applicable regulatory landscape. This includes identifying all relevant laws, regulations, and guidelines pertaining to healthcare data exchange. Subsequently, an evaluation of available data exchange protocols should be conducted, assessing each against these regulatory requirements, as well as against organizational needs for interoperability, security, and scalability. A risk assessment should be performed to identify potential vulnerabilities associated with each protocol. The final decision should be based on a comprehensive analysis that prioritizes compliance, security, and patient privacy, ensuring that the chosen protocol aligns with best practices and legal obligations. Question 16. Consider a scenario where a patient arrives at an emergency department in critical condition, unresponsive, and without any identification or family present. The emergency physician determines that immediate access to the patient's complete medical history, including past diagnoses, allergies, and current medications, is vital for effective treatment and to prevent harm. The hospital's health information exchange (HI) system contains this information, but the patient's consent for data sharing has not been obtained due to their unresponsiveness. What is the most appropriate course of action for the healthcare team to access the necessary patient information through the HIE? Option A. Delay treatment until a legal guardian can be appointed to provide consent for accessing the patient's HIE data to ensure full compliance with privacy regulations. Option B. Access the patient's information from the HIE, documenting the exigent circumstances and the medical necessity for treatment, and initiate the process to obtain formal consent from the patient or their legal representative as soon as they are able. Option C. Access the patient's information from the HIE without any documentation, as the emergency situation supersedes privacy concerns and formal consent is not required in such critical cases. Option D. Contact the HIE vendor directly to request they override the patient's consent settings for this emergency, bypassing the hospital's internal protocols. The correct answer is B. Access the patient's information from the HIE, documenting the exigent circumstances and the medical necessity for treatment, and initiate the process to obtain formal consent from the patient or their legal representative as soon as they are able. Explanation. This scenario presents a common yet complex challenge in health information exchange. High implementation, balancing the urgent need for patient data access during emergencies with the stringent requirements of patient privacy and consent. The professional challenge lies in navigating these competing priorities without compromising either patient safety or regulatory compliance. Careful judgment is required to ensure that any data access, even in exigent circumstances, adheres to established legal and ethical frameworks. Correct approach prioritizes obtaining consent or leveraging established legal exceptions for emergency access, while simultaneously initiating the process for formal consent and ensuring robust audit trails. This represents best professional practice because it upholds the principle of patient autonomy and privacy as mandated by relevant healthcare regulations, such as the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Specifically, HIPAA permits the disclosure of protected health information, FI, without patient authorization in certain emergency situations, provided that the disclosure is limited to the minimum necessary information to treat the patient and that efforts are made to obtain consent as soon as practicable. Maintaining detailed audit logs is crucial for accountability and demonstrating compliance. An incorrect approach that bypasses consent entirely and accesses PHI without a clear, documented legal basis for emergency disclosure fails to adhere to privacy regulations. This could lead to significant penalties, reputational damage, and erosion of patient trust. Another incorrect approach that delays the formal consent process or fails to implement robust audit trails after emergency access also falls short. While emergency access might be permissible, the subsequent steps to secure formal consent and maintain transparency are critical for ongoing compliance and ethical practice. Failing to do so creates a loophole for potential misuse of PHI and undermines the integrity of the HIE system. Professionals should employ a decision-making framework that begins with understanding the specific regulatory requirements for PHI disclosure, particularly in exigent circumstances. This involves assessing the imminence of the threat to the patient's life or health, the availability of less intrusive means to obtain the necessary information, and the feasibility of obtaining consent. If an exception applies, the disclosure must be strictly limited to the minimum necessary. Concurrently, a plan should be in place to obtain formal consent as soon as the emergency subsides and to document all access and disclosure activities meticulously. This proactive and compliant approach ensures both patient well-being and adherence to legal and ethical standards. Question 17. The investigation demonstrates that a recently implemented clinical decision support system, CDSS, in a hospital is exhibiting a pattern of providing recommendations that deviate from established evidence-based clinical pathways for a specific patient cohort. Clinicians have reported instances where the CDSS alerts are perceived as overly sensitive or irrelevant, leading to alert fatigue and a potential for critical recommendations to be overlooked. The IT department has confirmed the system is technically operational, but the root cause of the discrepancy in recommendations remains unclear. Which of the following represents the most appropriate course of action for the healthcare information and management systems professional to address this situation? Option A. Initiate a comprehensive review of the CDSS underlying logic, data sources, and configuration settings, involving clinical informatics specialists and end-user representatives, to identify and rectify any inaccuracies or misinterpretations of clinical guidelines. Option B. Immediately escalate the issue to the CDSS vendor for a complete system overhaul, assuming the problem lies solely with the external software. Option C. Advise clinicians to override the CDSS recommendations when they appear questionable, emphasizing that their clinical judgment should always take precedence over automated system outputs. Option D. Conduct a brief survey of the affected clinicians to gauge their general satisfaction with the CDSS and use this feedback to make minor adjustments to alert thresholds. The correct answer is A. Initiate a comprehensive review of the CDSS underlying logic, data sources, and configuration settings, involving clinical informatics specialists and end-user representatives, to identify and rectify any inaccuracies or misinterpretations of clinical guidelines. Explanation. The investigation demonstrates a scenario where a clinical decision support system, CDSS, has been implemented in a healthcare setting, and a potential issue has arisen regarding its accuracy and impact on patient care. This scenario is professionally challenging because it requires healthcare information and management systems professionals to balance technological innovation with patient safety and regulatory compliance. The core challenge lies in ensuring that the CDSS, while intended to improve care, does not inadvertently lead to suboptimal or harmful clinical decisions due to flaws in its design, data, or implementation. Careful judgment is required to identify the root cause of the issue and implement appropriate corrective actions while adhering to established healthcare regulations. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation into the CDSS performance. This involves engaging relevant stakeholders, including clinicians who use the system, IT professionals responsible for its maintenance, and potentially the CDSS vendor. The focus on data analysis, user feedback, and comparison against established clinical guidelines ensures that any identified discrepancies are addressed in a thorough and objective manner. This aligns with the principles of continuous quality improvement and patient safety, which are paramount in healthcare. Furthermore, such an approach is crucial for maintaining compliance with regulatory frameworks that mandate the safe and effective use of health information technology, ensuring that systems like CDSS are validated and monitored for accuracy and reliability. Each incorrect approach represents specific regulatory or ethical failures. One incorrect approach might involve dismissing the reported issue without thorough investigation, which fails to uphold the ethical duty to patient safety and could violate regulations requiring the reporting and remediation of adverse events or system malfunctions. Another incorrect approach could be to immediately blame the end users without considering potential system flaws, which is unprofessional and ignores the shared responsibility for system performance. This could also lead to a failure to identify systemic issues that require technical or design adjustments, thereby perpetuating the problem and potentially leading to further patient harm. A third incorrect approach might be to implement a quick fix without understanding the underlying cause, which risks introducing new problems or failing to resolve the original one, thereby violating principles of due diligence and potentially contravening regulations that require robust change management and validation of system updates. The professional reasoning process for similar situations should involve a structured approach. 1. Acknowledge and document the reported issue. 2. Initiate a multidisciplinary investigation involving all relevant parties. 3. Gather objective data and evidence related to the CDSS performance and the reported incidents. 4. Analyze the findings against established clinical standards and regulatory requirements. 5. Develop and implement a remediation plan based on the root cause analysis. 6. Monitor the effectiveness of the implemented solution and document all actions taken. 7. Communicate findings and actions to relevant stakeholders. This systematic process ensures accountability, promotes continuous improvement, and upholds the highest standards of patient care and regulatory compliance. Question 18. Upon reviewing the implementation plan for a new patient portal feature designed to integrate with third-party wellness applications, what is the most compliant and ethically sound approach to ensure patient privacy and data security while maximizing engagement? Option A. Prioritize rapid deployment of the feature to all users to encourage widespread adoption, addressing any potential privacy concerns reactively as they arise. Option B. Enable the integration by default for all patients, assuming that by using the portal, they implicitly consent to data sharing with any connected third-party wellness applications. Option C. Implement a phased rollout of the integration, providing patients with clear, easy-to-understand information about the data being shared, the purpose of the sharing, and requiring explicit opt-in consent for each third-party application before any data is exchanged. Option D. Proceed with the integration and rely on a general disclaimer within the portal's terms of service that broadly covers data sharing with third parties, without requiring specific patient action for each connection. The correct answer is C. Implement a phased rollout of the integration, providing patients with clear, easy-to-understand information about the data being shared, the purpose of the sharing, and requiring explicit opt-in consent for each third-party application before any data is exchanged. Explanation. This scenario presents a common implementation challenge for patient portals and engagement tools within the U.S. healthcare regulatory framework, specifically concerning the Health Insurance Portability and Accountability Act, HIPAA, and related guidance from the Office of the National Coordinator for Health Information Technology, ONC. The core challenge lies in balancing the desire for enhanced patient engagement and data accessibility with the stringent requirements for patient privacy, data security, and informed consent. Professionals must navigate the complexities of ensuring that any engagement tool, including those that allow for third-party data access, adhere strictly to HIPAA privacy and security rules. The correct approach prioritizes a phased rollout with robust patient education and explicit consent mechanisms. This aligns with best professional practice by ensuring that patients understand how their data will be used, who will have access, and the associated risks and benefits. It also allows the organization to identify and address potential security vulnerabilities or usability issues in a controlled environment before widespread adoption. This proactive stance minimizes the risk of privacy breaches and noncompliance with HIPAA, which mandates safeguards for protected health information. 5. Furthermore, it fosters patient trust and promotes meaningful engagement, which are key objectives of such tools. An incorrect approach that bypasses explicit patient consent for third-party data sharing, even for ostensibly beneficial purposes like research or wellness tracking, represents a significant regulatory and ethical failure. This directly violates HIPAA requirements for patient authorization for the use and disclosure of PHI for purposes other than treatment, payment, or healthcare operations, unless specific exceptions apply and are properly documented. Such an approach also fails to uphold the ethical principle of patient autonomy, as it presumes consent rather than actively obtaining it. Another incorrect approach that focuses solely on technical integration without considering the user experience and potential for data misuse by third parties is also professionally unacceptable. While technical functionality is important, it does not absolve the organization of its responsibility to ensure that the engagement tool is implemented in a way that protects patient privacy and security. This oversight can lead to unintended disclosures of PHI, violating HIPAA security rule, which requires administrative, physical, and technical safeguards. A third incorrect approach that relies on broad, generic terms of service for third-party applications without specific patient understanding or granular control over data sharing is equally problematic. This approach fails to meet the spirit and letter of HIPAA, which requires clear and understandable information for patients regarding their health data. It also neglects the ethical imperative to provide patients with meaningful control over their personal health information. The professional decision-making process for similar situations should involve a thorough risk assessment, a clear understanding of applicable regulations, HIPAA, HITECH Act, and a patient-centered design philosophy. Professionals must engage in a multi-stakeholder approach, including legal counsel, compliance officers, IT security, and patient advocacy groups, to develop and implement patient engagement tools. Prioritizing transparency, patient education, and robust consent mechanisms are paramount to ensuring both regulatory compliance and effective patient engagement. Question 19. System analysis indicates that a healthcare organization is planning to integrate a significant number of Internet of Things, IoT, medical devices into its existing network infrastructure to enhance patient monitoring capabilities. What is the most appropriate approach to manage the associated network security risks? Option A. Integrate the new IoT devices directly into the existing core network to simplify management and leverage existing security measures. Option B. Prioritize the functionality and cost-effectiveness of the IoT devices, addressing security concerns only if a breach occurs. Option C. Deploy the IoT devices and rely solely on the current firewall and intrusion detection systems to protect the network. Option D. Conduct a comprehensive security risk assessment for all new IoT devices. Implement network segmentation to isolate these devices and establish continuous monitoring protocols. The correct answer is D. Conduct a comprehensive security risk assessment for all new IoT devices. Implement network segmentation to isolate these devices and establish continuous monitoring protocols. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare IT where the introduction of new technologies, like IoT devices, can significantly expand the network attack surface. A professional challenge lies in balancing the benefits of these new devices with the inherent security risks they introduce, particularly concerning patient data privacy and system integrity. The need for careful judgment arises from the potential for these devices to be entry points for cyber attacks, leading to data breaches, service disruptions, and compromise patient care, all of which have significant regulatory and ethical implications. Correct approach analysis. The correct approach involves a comprehensive risk assessment and the implementation of a layered security strategy specifically tailored to the unique vulnerabilities of EOT devices within the healthcare network. This includes segmenting the network to isolate EOT devices, employing robust authentication and authorization mechanisms, and establishing continuous monitoring for suspicious activity. This approach aligns with the principles of data protection and patient safety mandated by healthcare regulations. By proactively identifying and mitigating risks, it ensures compliance with requirements for safeguarding protected health information. 5. And maintaining the availability and integrity of healthcare systems. Incorrect approaches analysis. Implementing EOT devices without a thorough security assessment and network segmentation exposes the entire healthcare network to undue risk. This failure to conduct due diligence constitutes a regulatory violation, as it neglects the duty to protect patient data from unauthorized access or disclosure. Relying solely on existing perimeter security is insufficient because EOT devices often have different security protocols and may bypass traditional defenses, creating vulnerabilities that attackers can exploit. This oversight can lead to breaches of PHI, resulting in significant fines and reputational damage. Integrating EOT devices directly into the core network without considering their specific security profiles and potential for introducing malware or network instability is a direct contravention of best practices for network security and risk management in healthcare. This approach disregards the principle of least privilege and the need for specialized security controls for diverse device types, increasing the likelihood of a security incident. Professional reasoning. Healthcare IT professionals must adopt a proactive and risk-based approach to network architecture. This involves a continuous cycle of assessment, planning, implementation, and monitoring. When introducing new technologies, the decision-making process should prioritize patient safety and data privacy. This includes understanding the specific regulatory requirements applicable to the jurisdiction, conducting thorough threat modeling for new devices, and designing network architectures that incorporate defense-in-depth strategies. Professionals should always advocate for security measures that are commensurate with the risks identified, ensuring that the benefits of technological advancements do not come at the expense of patient trust and regulatory compliance. Question 20. Examination of the data shows a request from the research department for access to a dataset containing patient demographic information, diagnoses, and treatment plans for a study on treatment efficacy. The data is currently stored in an electronic health record system and contains direct identifiers. The research department has not obtained individual patient authorizations for this specific study, nor has an institutional review board or privacy board granted a waiver of authorization. Which of the following actions best ensures compliance with HIPAA regulations for this scenario? Option A. Inform the research department that the data cannot be used for research without explicit patient consent for every individual in the dataset. Option B. Provide the identifiable dataset to the research department as the request is for research purposes, which is generally permitted. Option C. Advise the research department to proceed with their analysis using the identifiable data and to implement their own internal privacy measures. Option D. De-identify the dataset to meet the HIPAA safe harbor or expert determination method before providing it to the research department. Correct answer is D. De-identify the dataset to meet the HIPAA safe harbor or expert determination method before providing it to the research department. Explanation. This scenario presents a common challenge in healthcare information management, balancing the need for data analysis with the stringent privacy requirements of HIPAA. The professional challenge lies in identifying authorized uses of protected health information, for research purposes, while ensuring compliance with the privacy rule. The need for careful judgment arises from the potential for inadvertent disclosure of PHI if proper de-identification or authorization procedures are not followed. The correct approach involves understanding the specific provisions within HIPAA that permit the use of PHI for research. This typically requires either obtaining patient authorization or de-identifying the data to a standard that removes all direct and indirect identifiers, rendering it no longer PHI. This approach represents best professional practice because it directly adheres to the HIPAA privacy rules stipulations for research use, safeguarding patient privacy while enabling valuable health research. It demonstrates a commitment to both regulatory compliance and ethical data handling. An incorrect approach would be to proceed with the analysis using identifiable PHI without explicit patient authorization or proper de-identification. This directly violates the HIPAA privacy rule, specifically the requirements for the use and disclosure of PHI. Ethically, it breaches patient trust and the expectation of privacy. Another incorrect approach would be to assume that any research use is permissible without understanding the specific conditions outlined in HIPAA, such as the need for a waiver of authorization from an institutional review board (IRB) or a privacy board. This demonstrates a lack of regulatory knowledge and a failure to implement appropriate safeguards. A further incorrect approach might be to attempt to de-identify the data using an informal or incomplete method, which could still leave residual identifiers, thus failing to meet the HIPAA standard for de-identification and continuing to treat the data as PHI. The professional decision-making process for similar situations should begin with a thorough understanding of the intended use of the data. If the data involves PHI and the intended use is research, the professional must consult the HIPAA privacy rule. Key considerations include whether patient authorization has been obtained, whether the research has been approved by an IRB or privacy board that has granted a waiver of authorization, or whether the data can be effectively de-identified according to HIPAA standards. If any of these conditions are not met, the data cannot be used for the intended purpose without further steps to ensure compliance. This systematic approach ensures that all regulatory and ethical obligations are met before any action is taken.